So he looked with his assistant Rosalie Rayner, he looked at the conditioning of human emotion. He had this little boy, little Albert, who he did not have fear of rats and white mice, white rat. So the white rat was not causing any fear for this baby. A loud noise, which was a steel bar hit with a hammer. Sometimes people say it was a really loud bell, but it was a steel bar hit with a hammer, or a gong, some people say, but causes fear. So a very loud noise is fear is a natural reaction of a baby to a very loud noise. So if you pair these two together, what happens? The baby then begins to have fear oops, I thought I had another picture there, has fear to the loud noise, to the rat as well. Okay, so after conditioning, we have the rat is now the conditioned stimulus, and the baby responds to the rat with fear. Later, we present white rabbits. Baby is afraid. Present fuzzy Santa Claus beard. Baby's afraid. Present a brown rabbit. Baby's not afraid. Present a white fuzzy sweater. Baby's not afraid. Discrimination, like we talked about with the cars screeching, is happening here. Baby knows the difference between these things. It's not happening. The fear is not happening. Here, baby actually would know the difference between a rabbit and a Santa Claus, but what happens is the baby has been so strongly conditioned to respond to something white, soft, and fuzzy with fear that they are responding to these things also, which is called stimulus generalization. So here's a review. We have unconditioned stimulus, unconditioned response, and which is a reflex and neutral stimulus. Conditioned stimulus and conditioned response is what is learned. Okay. Stimulus generalization is when somebody responds to something similar to the original stimulus, and discrimination is when we don't respond to something similar to the stimulus. Extinction is when the response goes away because the thing has been presented without a response for a long time. And spontaneous recovery is something that happens when it's been a while since the extinction, and then it kind of happens again. So if the fear was eradicated, the fear to the white rat was eradicated, so the baby wasn't afraid anymore, and then down the road a while, next month, the baby sees a white rat, they might be afraid again. So in real life, think about real life. Think about those questions I asked in the beginning and the examples maybe you thought of in your own life, and think about whether you can apply these principles to those things. Is classical conditioning enough of an explanation for that, or is there something else going on? Is it a voluntary response, maybe, not an involuntary response? So phobias are something that are a conditioned response typically, and there's some sort of reflex of fear, like bridges are conditioned. Typically, phobias of bridges are a conditioned response. And here we have patients receiving chemotherapy. One technique to make things easier, so they are the association of nausea to chemotherapy. Sometimes patients will come in and already feel sick before they even get their chemo. So there's actually a lot of counter conditioning that happens at cancer clinics sometimes, where they will find ways to condition positive responses to coming to that clinic that can help with the nausea. Okay, so we're going to stop here, and the next video that I post will have more information about instrumental conditioning. No quiz this.